Examining the ear canal and drum can be difficult in young children who are sensitive and fearful because they cannot observe the procedure. Many children need to be restrained during this examination, which is why you may want to leave it for the end. The two best positions to work from include the child lying down and restrained by the parent, or in younger children, sitting on the parent's lap with the child's legs restrained by the parent's legs. To view the tympanic membrane in young children, the auricle must be pulled upward, outward, and backward to afford the best observation with the otoscope. A technique preferred by many pediatricians as a way to hold the otoscope when examining children is to hold the child's head with one hand and with that same hand pull on the auricle. With the other hand, position the otoscope with the handle pointing downward. A pneumatic otoscope allows you to assess the mobility of the tympanic membrane as you increase or decrease the pressure in the external auditory canal by squeezing the rubber bulb. Although formal hearing testing is necessary for accurate detection of hearing deficits in young children, you can grossly test for hearing standing behind the child and have them repeat your whispered words while you cover one of the child's ear canals and rub the tragus using a circular motion.
And then you tell me what you hear. Ready?
22.
Good.
Then test the other ear.
Zebra.
Zebra is right. Good job.
Inspect the nose using a large speculum on your otoscope. Check for nasal deviation and polyps, and note the color and condition of the nasal mucous membranes. Pale, boggy nasal mucous membranes are found in children with chronic perennial allergic rhinitis. When examining the mouths of young children, you should wear gloves. Ingenuity may be necessary to make the child open his mouth. Here are some tips to encourage the child's cooperation. Turn the examination into a game. Say,
And can you breathe like a puppy dog and go,
don't show the tongue blade unless absolutely necessary. The child who can say ah usually offers a sufficient, albeit brief, view of the posterior pharynx, rendering a tongue blade unnecessary.
good job.
Offer enthusiastic praise when children open their mouths a little, and encourage them to open even wider. With the child's mouth open, examine the upper and lower lips. Examine the tongue, including the underside. Note the size, position, symmetry, and appearance of the tonsils. The peak growth of tonsillar tissue is between 8 and 16 years. Then, lift the upper lip to examine the upper teeth. Look for staining or signs of erosion, which often first appear here and which may signify the need for a dental referral. Finally, note the quality of the child's voice. Certain abnormalities can change the pitch and quality of the voice. Examine